October the 16th. This is the Metro Council Public Health and Safety Committee special called meeting on domestic violence in Davidson County. I really appreciate my peers for being here and those of you who are watching from home. There will be the presentation that you'll be hearing or seeing today on your screen and in the chamber will be put on the Metro Council SharePoint site, so that will be available for members of the public to review. I'd like to recognize our Vice Mayor, Angie Henderson, and our Council Attorney Director, Margaret Darby, who are over here to my side in case we need anything from either of them. But with that, I'm going to, first of all, kind of level set, I guess, where we are. The reason why we're doing these sessions, first of all, if you have been watching the news, there's a tremendous number of news stories about domestic violence in Davidson County. Some of them have been very prominent in news stories. And of course, that creates many questions for residents and also survivors of domestic violence who really want to understand, what is the city doing to be able to improve kind of the situation in our community. And so Diane Lance and Becky Bullard from the Office of Family Safety were very kind to agree to come and speak to the council and really kind of level set the activities around the response to domestic violence and kind of give us a level set of the landscape in Davidson County. We have 2 additional meetings coming up. One is on the 23rd, where council members will be going to the Gene Crow Advocacy Center and doing some court watching and kind of going through a simulation called In Her Shoes to learn even more. And then on the 30th of the month, we'll also reconvene back here in the chambers to hear from MNPD, the district attorney's office, the sheriff's office, all about kind of their perspective related to this issue in our county. And it's all in recognition of Domestic Violence Awareness Month. So with that, I'm going to turn it over to Diane Lance, who's the director of the Office of Family Safety, and Becky Bullard, who's the deputy director of programs.
Thank you so much. We really appreciate the opportunity to be here. Thank you, Vice Mayor and Chair of the Health and Public Safety, Aaron. This is a great opportunity for us to explain a big chunk of our public safety here, which is the accountability part of our city. Want to really appreciate our team in the back. We have quite a few members from our department. If you can just raise your hand. We have Sharon Roberson, some of her team members from the YWCA. Moms Demand Action, and I don't know if I've missed anyone else, but we just appreciate everyone coming out and showing their support. So real fast introduction, I'm the department head for Metro's Office of Family Safety. My background, I'm a former prosecutor. My specialty was domestic violence crimes and then crimes, sex abuse against children and child homicide. So that's sort of how my career path took in the criminal justice system. From there, after a little bit of time, I went and worked in Carl Dean's administration, and the bulk of my projects in his office was a domestic violence safety and accountability audit, and we'll tell you a little bit about that more. I'm gonna have Becky go ahead and tell you her background, which is much more impressive than mine.
Hi, everyone. I'm Becky Bullard, the Deputy Director of Programs at the Office of Family Safety, and I've been doing this work on victim services for over 20 years, and luckily gotten to see a lot of different perspectives in that. I've worked in shelter programs, actually in the YWCA's shelter here in Nashville many, many years ago. I was the victim witness coordinator for the district attorney's office here, and then was able to move into some work on the national level with the National Human Trafficking Hotline, as well as working with the Denver District Attorney's Office. And then I came back to Nashville and everyone said, you need to meet Diane Lance and hear all about this new Family Justice Center that we're creating in Nashville. So I have been with the Office of Family Safety for almost 9 years.
So we thought we worked really hard to try to figure out how to best paint the picture to answer some of the questions about some of the high publicity cases and where we are as a city. And it's a little challenging to do because we have to lay the framework of the criminal justice system, the state of domestic violence in our city, why specialization is so important, why you treat these cases differently, and then go on to where our biggest concerns are. And right now we have some tremendous concerns that we think are appropriate time to look at in our court system. It's time to redo some of the things that we do. So in your folder, you have these items. You have a purple folder on your desk, and so we hope you do take the time to look over it. We have our office's annual report. We have our fatality review report from last year. Every year, our office takes one domestic violence homicide and looks at it with a team, including folks you see in the back and the YWCA, to figure out where the lessons are, we can learn lessons, like where we could have improved services to this person or response systems. We have our Interpersonal Violence Summit report. Every 2 years, we have a summit on the topic of interpersonal violence, and that's where we gather information on where our strengths and weaknesses are. Becky and I have worked on a court issue summary document. I think it's on your right side, second document or top document, I think. And it has the scales of justice on it. That is our summary of where we think the issues are. And so a lot of what we're going to be talking about towards the end is in that document and explains it probably better than anything else. We also have some statistics from the Office of Criminal Justice Planning, timeline of the work that's been done on firearm dispossession, and some articles and recent, some scholarly articles and recent news articles that we think would be of interest. So real fast, most of you know who we are, but we always just like to go right back to our mission. So we focus on crisis intervention and support for the purpose of increasing domestic violence and interpersonal violence victim safety and offender accountability. And interpersonal violence includes domestic violence, sexual assault, human trafficking, stalking, child abuse, and vulnerable adult abuse. Okay, but the bulk of our clients are domestic violence clients. We do this work not just as a standalone team of the Office of Family Safety, but with our larger community, our many nonprofit partners and other departments within our government that work adjacent to our work. And the other thing that we do is we do systems assessment. So we can work on improving victim safety, like in the moment, in the crisis. We can look to improving safety, like, maybe in the next month or two, but someone's got to be looking at how the systems could be doing better, or you're just going to keep spinning your wheels. So that is a really important part of our mission, and we do all this at our 2 family justice centers. All of this work was modeled off of our safety and accountability audit that we did from 2011 to 2013, where we looked at all these aspects of our work with domestic violence, and we looked at how we can improve victim safety and offender accountability. The audit took 2 years. This was out of Mayor Carl Dean's administration. We had over 100 people involved, nonprofits, Metro government employees, and lots of survivors. And we just looked at how they're responding and what they can do better. And that photo is when Carl Dean released the recommendations report, and he had all the city leaders that were involved with it get behind furthering those recommendations. We've made a lot of really good progress. These were the main recommendations in that 2013 report, and we made tremendous strides for the things that we can control on a day-to-day basis. Working to close those gaps, and most importantly, institutionalizing the improvements that we made. So in the 1990s, Nashville was cutting edge in our response to domestic violence. Cities from all over the country came to Nashville to see how we did things. I was lucky to be a prosecutor during that time. So, and Becky was unfortunate to be a victim witness coordinator after that time. But when you neglect something and you don't have it institutionalized, it just falls to pieces. And that's really what happened in Nashville. You can take, years to build something great, and then neglect makes it deteriorate, just so quickly. And that's what happened. So by the time I came back into this work and I went to a national conference, we were used as the example of what not to do, which was horrifying I'm pretty darn competitive, and that was really upsetting to see the head of a national conference be saying really negative things about Nashville and Tennessee as a whole. So we do all of this work with our office's 5 teams in partnership with our nonprofit and Metro partners. So you see it kind of goes from micro work to macro work. So from direct client service work, we have crisis advocacy and case management with over 17,000 client visits a year. We have outreach and engagement because we got to get people to know that the family safety centers are here and get them to come for help when they need it. We have training, which trains over 9,000 people a year across the country and obviously locally and across the state. And we have high-risk multidisciplinary teams and task forces that work really hard to make sure our system doesn't treat every case the same. A high-risk victim is very different than a non-high-risk victim, and all the response systems need to be more rapid. And we'll talk a lot about that soon. So again, these work happens at our family safety centers. Our community-based one is, you can see on this slide, on Murfreesboro Pike. The headquarters is attached to us, is the largest center of its kind, and it provides compassionate, coordinated response to victims of domestic violence and interpersonal violence in a safe, supportive, and convenient location. And it is now the national model for family justice centers across the country, which that same guy that criticized us actually said those words. So then the Gene Crow Advocacy Center, that's our court-based center, right over there in the Ben West building. And that's to ensure victims are safe and supported when they come to court. So they're not just sitting in the courtroom near their offender for hours on end and not getting anything out of it. So they have a safe and separate place to wait for court, and they have crisis advocates helping them with an order of protection, safety planning, domestic violence education, and things like that. This center is the first of its kind in the country, and it's also a national model. So people come from around the country to see how that center works. Family safety centers are all over the country. You can see from this map. Tennessee actually has the most per capita. California has the most in all, but we have the most per capita. So the other thing that people come to learn about what we do besides our two family safety centers is how we do advocacy and multidisciplinary teamwork with the highest risk victims in our city. So the concept of a family safety center, it's basically trying to be like the Walmart of helpful services to victims. We want a one-stop location for victims of interpersonal violence that is staffed by experts in the field that are well-trained, and to work closely with partners, and some will co-locate, to bring the helpful services together in a much more seamless way. And this is great because it helps reduce the runaround victims can get when they're trying to get help. That will hopefully reduce the number of people that get discouraged and stop seeking help. It helps victims not feel like they're repeating themselves, like they're starting at point one again and telling their story and what they need. It also helps us all stop duplicating our work. So if we're working together, we see what each other are doing and we don't duplicate. And that's a really big advantage of this type of model. So this is the states across the country that have come to Nashville to see how we do things, and the ones with the asterisks have had different cities and their states come. I think that slide's probably a little out of date, but so they're just all over the place. So Becky.
Right. So homicide prevention is an important piece of what we look at. And because we're focused on homicide prevention, it's really important for us to think about what we're seeing across the state of Tennessee, because in 20 of the last 25 years, the Violence Policy Center, which is a nonprofit that looks at data around femicide, which is essentially how they're measuring it, is men who are murdering women. They have found that Tennessee is always in the top 10 states for the most femicides that are committed in states around the U.S. So 20 out of 25 years. That really means that violence against women in the state of Tennessee is not only a problem, it's an epidemic. So we focus on the homicide prevention component and those high risk factors because of what we see statewide and then also what we see locally. So locally, 15% of homicides in Nashville are domestic violence homicides. That's a pretty average statistics. That's over a 10-year period from 2011 to 2021, but that is consistently what we see. Around 15% of the homicides here are domestic violence. Of those homicides, 57% are committed with a firearm. So that is typically the weapon of choice for domestic violence murderers. 34% of those individuals were prohibited from having that firearm when they perpetrated that murder. So they're prohibited because they might have had a felony charge, a domestic violence misdemeanor charge, or an active order of protection against them. And then 55% of homicide perpetrators since 2016 also engaged in another type of crime in the community. So a lot of times when we hear conversations around community violence, one of the components that's missing is the domestic violence component. Because we like to say if someone is perpetrating violence in the community, they're also most certainly perpetrating some form of violence in their homes as well. The other disturbing trend that we see with abuse, especially over the last decade, is the involvement with children. So as you can see here, between 2012 and 2016, we didn't see children who were impacted by domestic violence, homicides, or familicides. Familicide is the term used when a whole family is murdered. And unfortunately, what we're consistently seeing over the last several years is that homicides, when the children are present, often are involving children now. So year after year, we're seeing children who are also murdered alongside an intimate partner in domestic violence. So when we talk about risk and how we're preventing homicides, our office looks at risk prevention mechanisms from evidence-based research around what is a high-risk case, what is a lethality marker. So these are some of those lethality markers that we look at. We use several different tools. Nashville Police Department uses the lethality assessment. Our office uses another version of that that's a little bit longer called the danger assessment. And these are those markers that kind of stand out to us when we're looking at cases where they're at high risk of being murdered. So you can see sexual assault, stalking, access to firearms, strangulation, threats to kill, and threats or assaults with a weapon. So for our office, when we're meeting with clients in our crisis intervention work and in our case management, we're doing that longer danger assessment. And we find that clients are very consistently showing us a number of high-risk indicators. So strangulation is one of those really high-risk indicators that we see frequently. Over 50% of our clients are saying they've been strangled at some point by their intimate partner. That's consistent with the lethality assessment that is administered by police. They see over 50% saying they've been strangled. So it's really important for us to focus on those high-risk cases, especially when markers are consistent with each other. So when we see a strangulation that is also paired with, for example, having access to a lethal weapon, that increases risk. So as you can see here, almost 40% of the individuals that we've worked with have been threatened by a lethal weapon, and about 26% have been sexually assaulted. We also look at all these high-risk clients that are coming through our centers and review those cases with our partners. So with the YWCA, the Mary Parish Center, our district attorney's office, police, Department of Children's Services, we meet to review these high-risk cases. In fact, we had one of those meetings today where we went through over 20 cases of high-risk intimate partner violence. And I can say I remember one case that had every single one of these flags or markers. And this was someone that we have seen as a high-risk person over years and years. So what we do when we're in those meetings is really look at what we can do to better surround that victim with services and safety, and how are we holding that offender accountable? What are the things that we can use through the courts, through probation and police to make sure that that offender doesn't keep perpetrating? And unfortunately, that offender had perpetrated against 3 different women over the span of about 4 years. We also see a real link between mass violence and domestic violence. So oftentimes when people in our field hear about mass violence incidents, we are waiting for the other shoe to drop. We're waiting to hear about what is the link to other forms of abuse that this person has used in the past. So the current statistics that you see is that 54% of mass violence shootings are directly related to domestic violence. That means that they're going after that intimate partner or family member, child that is in their immediate familial circle. But that doesn't even account for the number of individuals who have domestic violence perpetration in their past. For example, the Pulse nightclub shooter was a strangler. He strangled his previous wife. So this number doesn't even encapsulate those individuals with a history of domestic violence. So there's a very large correlation. And just to highlight from our most recent mass shooting that we had here, unfortunately, in Nashville, this individual, the defendant, Marquise Davis, who's been recently arrested, to highlight he was a convicted felon, someone who shouldn't have been in possession of a firearm, and also was a part of a domestic incident with his friend, helping his friend hold his girlfriend hostage. So we can see that linkage between domestic violence and mass shootings in a number of ways.
So on there, so you've got sort of the lay of the land of where we focus our work. So a lot on high risk for homicide prevention. And what we want to go into is how widespread this is, the ripple effects of each of those cases that we're talking about. And domestic violence and the children living in those homes is a really important talking point. So sometimes people focus a lot on if the children are being abused also, which there's a very high percentage that are. But what is happening to those children that are witnessing it, who are living there every day, basically with a terrorist in their home, who's using terror as a way of controlling the family? So children that grow up in these households are at 1,500% higher risk of having co-occurring child abuse or neglect. Okay, so we know that the likelihood that they are victims as well is extremely high. Infants, this was really surprising to me. This is a new study. Infants, even in utero, are affected by the trauma of domestic violence. Constant activation of domestic violence also is constant activation of a child's stress and trauma responses in their brain and their learning that is actually changing the architecture of a child's brain to live in these homes. It impacts their ability to learn, to regulate their emotions, and engage socially. As adults, because it continues on past childhood, those adults that grew up as child in a domestic violence household are 6 times more likely to commit suicide. They're 50% more likely to abuse drugs and alcohol, 74% more likely to commit a violent crime. And growing up in a domestic violence household is the most significant predictor of whether they will engage in domestic violence later in life. So investing in children in these homes as well is extremely important. Beyond the children in the home and the family members in the home, we're all paying for this every day. There's a tremendous economic impact of domestic violence, $8.3 billion nationally and an estimated $886 million for Tennessee. These costs include lost wages, productivity, sick leave from employers, absenteeism, direct medical costs, costs of the judicial system, costs of law enforcement, jails, things like that. The likelihood that each of you in here, and when the room is full, everyone in this room knows someone who is a victim of domestic violence is really high. I mean, you talk to any one of us. I mean, every time we go to a conference and we take an Uber and they always ask what you're doing and we say we're going to a conference and then they say what conference and we tell them what conference. Every single time they are either a victim right then, they have been a victim, or their best friend is a victim, or their mother was a victim. I mean, it's every single time. So we try not to talk about what we do in the Uber rides. But every minute, 20 people are victims of intimate partner violence, and 1 in 3 women and 1 in 10 men experience this type of abuse in their lifetime. Your workplace, it's happening at your workplace, big or small. 87% of victims get harassing calls at work. 64%, their ability to work is impacted by abuse. And 8 million in costs for 8 million days of victims will lose time off work. I think that's what that last one means. Is that what that means? Yep. Even your closer colleagues, homicide is the second leading cause in workplace death. We've had several cases of that in the last 10 years here in Nashville. And workplace violence is most often tied to personal relationships. So what are the barriers for victims? So we've gotten where the state is in Nashville. We're learning that we all know someone. The cost and impact is widespread. The other thing that makes these cases really important, but also really tricky, is how hard it is for victims to get help. Not necessarily because help isn't available, but there are a lot of barriers in front of them. I hope we are past the days of people saying, well, why doesn't she just leave? But just in case, we're going to just go over some of the barriers. And these are what survivors tell us. and tell people in our field is what makes it really hard, because it usually takes about 7 times if a victim's going to leave. Not being believed. I'm sure the offenders most often are the biggest voices in their life telling them that no one's going to believe you. Fear of the abuse escalating. I mean, your abusers promised you if you do something, if you leave them, if you call the police, this is what's going to happen next. Lack of resources to leave. Maybe there are children in the home, the victim doesn't have a job, family isn't supportive. Shame and stigma. The neighbor seeing everything about your business is certainly a barrier. They might believe they are to blame. We see that a lot. That, well, if you hadn't given me this reason, if you hadn't been looking at that guy at the bar, I wouldn't have had to do that to you. So that gets really internalized over a long time when you're told things like that. Children, what's best for the children? They need their dad. I don't want them to have to go to a different school if I leave. And then making good on past threats. Again, they're living with someone who is making threats to them on a regular basis of what will happen. And so there's a lot of fear of those threats actually coming to fruition. And then just remembering that the victim is not the one with the power and control in the relationship. So when people say, well, why doesn't she just leave? Well, that's a statement you say to someone who has the power and control in a relationship. And that's what the offender is all about, maintaining and exerting his own power and control. So in a victim's head, these might be some of the internal statements that they're saying from those barriers. I know I'm starting on the top left. I know he's sorry. I don't want to hurt him. So maybe there's some guilt there. He said, I will never see the kids again if I leave. I'm pretty sure I'd stay if I thought I wouldn't see my kids again, or he'd have unsupervised time alone with my children. He said he'd kill me if I ever call the police. He's going to be so mad. I can't go to a shelter and uproot my kids from their friends in school. He's a good dad. The kids need their dad. Just need all of this to go away. So when a victim calls the police, they are inviting an entire team of people into their life. So if Becky's, abusing me in our home, and I pick up the phone and call 911, I am calling 911 so she'll stop, right? So this will stop and I will be safe again. But the impact of calling 911 is much greater. So the police come, they're going to stick around for a while, they're going to ask a lot of questions, they're going to do the lethality assessment. I'll get on the phone with the YWCA, then there'll be a warrant. They're going to ask me if I want to take out an order of protection. The warrant will process through. The next thing I know, I'm getting subpoenas, I'm getting calls from the district attorney's office, I'm getting calls from the Office of Family Safety, and this all of a sudden, all of these things are brought into my life when really I picked up the phone because I needed her to stop hitting me. And I was scared. So that's why I have that one, this is just too much. I wish it would all go away. These court dates are going to get me fired. Just like he said, no one will ever believe me. Everyone's making it worse. I just need it to stop. And what if he gets out of jail? The order of protection is a piece of paper and it won't keep me away. And when I was working on that slide and I was looking at these, and it really did make me wonder, she's probably being pretty smart. I mean, these are all real concerns about the escalation of violence, what happens with the children. I mean, those are real concerns. So when she's watching her life and what she's done, she's making the best educated decision she can make. And so our work and our partners' work is to show what those other options are that they may not know about yet. Victims often side with their abuser, publicly, to family, to police, to prosecutors, because long after the police leave, even after the charges are filed and a sentence is meted out, it is with the abuser that the victim must continually negotiate her life and the life of her children. Now, I know we have a lot of pages to go through. This is always a great point just to tell you. I had a case where a victim fought against prosecution for 3 years. And finally, after we had a case with a successful prosecution, the second the holding cell door shut behind him, he took off all his jewelry and handed it to her. She was screaming, crying, cussing me out as the prosecutor. But the second security took him into the back, she popped up after 3 years of fighting with me over this and said, I'm going to the pawn shop and I'm never going to see that SOB again. She's just waiting for us to do our jobs effectively. And she had to put on the show she needed to put on. At the end of the day, leaving can be very deadly. It's one of the most risky times for victims of domestic violence. So again, is she being weak, or is she making a really smart and strong decision in what we see and what causes hardship in us prosecuting these cases? So for those reasons, specialization in the work in this area is absolutely essential. And here are just some basic reasons. It is a predatory crime. Becky told you the story of someone who had 3 victims over that period of time. I mean, if you're not my victim and you leave me, I'm just going to go find someone else. And if you are still my victim, I'm just going to keep coming at you until I can't anymore. So, like, I have someone in my sights and I'm going to keep going back. It's predatory. Very different if someone breaks into your car, robs you at gunpoint at an ATM. It's an escalating crime. The deadliness will increase over time. So let's say we have someone who has a habit of lighting small fires. We're going to be worried about that person lighting big fires of buildings with people in them. It's the same with domestic violence, but for some reason, it just doesn't get the same juice behind it with our concern about what is going to happen when this escalates. The danger is predictable at this point. So when we first started working, we didn't have these tools that tell us if this victim is at high risk. We do now. They're evidence-based. And so we have that information these days. And the impact is expansive, which we talked about with all the secondary types of victimization and lasting impact. Again, why it's important: ongoing victim intimidation and manipulation. Time weakens these cases. And this is going to be something that we're going to get into in the meat of this, is why we need to handle these cases faster. It's just essential. And the vulnerability of the victim, her isolation, shame, social biases, things like that. All right, so into court. So we do have specialized courts. So specialization is essential, and that means people that are trained and interested and passionate about this work. So you can have someone be well-trained, but if they don't care about this type of work, they're not going to do a good job. They can be well-trained, but still have a bias against domestic violence victim, and they are actually could actually put a victim at increased risk. So this is a chart of our court system. And I know some of you understand the court system and some may not. So we're just going to walk through it a couple of times. So the top line is, you see the 911 call. So there's an abusive incident, 911 is called. Police respond, and the offender is arrested and most likely will make bond. So we have night court commissioners that set those bonds. And night court goes on 24/7, but it's just called night court. And then, so let's say that offender makes that bond, there is an initial court date in general sessions criminal court. And then the case may be disposed of there, right? It could be dismissed, it could be retired, it could be continued with conditions and then dismissed or retired. It can be nollied, which is basically the same thing, just saying it in a fancier way. And there could be a conviction with things you have to do on your probation. But also, it may get bound over to criminal court. Like, you don't have to resolve a case at that level. You can say, I want to go up to jury trial court, and your case will go up there. And if it's going to stay a felony, it'll go up to criminal court. It takes 93 days from arrest to disposition to get from that arrest to the disposition in a general sessions bond docket. 3 months. I mean, do you think we're going to have a victim sticking around with us for 3 months? Because that's just not like, oh, come back in 90 days. That's, I've come to court over and over and over again, and the case is getting continued. Because guess what? Like, defense attorneys know time is going to make this case worse. Offenders know, I just need more time to influence what she says. So time is not our friend. The bottom is what happens with orders of protection. So they come to our office for the order of protection. That's an ex parte order of protection. It's then set also in general sessions court or circuit court in this building. And then the order of protection is either granted or dismissed. Okay. We also have non-specialized domestic violence courts. So general sessions, we have some specialized judges. But if the case goes up to jury trial court, and I'm just going to keep calling it that because it's easier to separate, that does not have specialized judges. Okay, that just gets sent across all courtrooms without specialized prosecutors and without specialized judges and without specialized state probation. So if the case gets bound over to go to jury trial court, so in general sessions, they have a preliminary hearing, it gets bound over to go to jury trial court, and then the case goes to the district attorney's office. So he's still out on bond during all this time. Then the grand jury hears the case and they true bill it, they true bill the indictment, and then it gets set in court for its first trial and some other settings that it has, like negotiations on the case. And then maybe it gets to a jury trial, but oftentimes they'll settle. That takes 103 days from bound over to first setting, just to the first setting, and 380 days to get to the disposition. So we are well over a year now. And your case is a disaster by this point. So if you're a defense attorney and you have a simple assault that you want to go away, have a preliminary hearing. Because then it's going to sit there for 380 days. It's going to be a low priority case because it's a misdemeanor. Even if it's a strangulation, bind it over. You know, even if they would have given me probation for a misdemeanor, bind it over because it's going to go away. That's what's happening every day with these cases. We have extremely serious crimes over that get bound over and the cases crumble. So getting back to our systems and our oversight, to the foundational part of our work that isn't direct services.
So the systems change piece that we do is something that we really pull in from a number of different places. It's a critical part of our mission. And it comes from the things that we learn from our clients. It comes from the things that we learn from our partners and the things that we observe just throughout the system, the criminal justice system and our community-based response system. So we're looking at this same assessment layout that we had in 2013 every day since the assessment took place. And that's just a critical component of our office because we don't want to see things backslide. We don't want to be the national model of what not to do. And we need to really preserve the work that we have done and the progress that we've made. So we are constantly evaluating that through those observations and then also bringing together our partners to talk through what they're seeing from their perspective. Because our office can only hold so much and see so much, we want to make sure that everyone that's doing this work is able to provide us with information about where we can improve, what are some new and innovative programs that we can adopt. So we hold interpersonal violence task forces. So those are all of the interpersonal violence, including domestic violence, where we're bringing together partners every 2 times a year to have our task force meetings. Every 2 years, we have a big summit. And the difference with the summit is that we're bringing together folks to talk about all of these ideas and thoughts we've had over the last 2 years and saying, what do we want to make as official recommendations and how we can improve our work? Where do we think we're doing things really well? And where can we grow in Nashville so that we can become the safest city for the people of Nashville? So we, for example, you have a draft of the Interpersonal Violence Summit from 2023 in your folder, and it goes over all the different speakers that we had from all of our multidisciplinary teams, the topics that we covered, and some of our initial recommendations. We will have a release from this summit of an official report, as well as an update to our 2013 assessment. So a kind of 10-year update of where have we come in Nashville with this work. So that will be coming hopefully towards the end of this year. And then, as I mentioned, we are pulling information from so many different places. For example, we recently went to roll call trainings with our Metro Nashville Police Department to talk with them about our high-risk work and got a lot of information from them about where they need support and what kind of improvements they can see. So, of course, we're working with Chief Drake on those and working with how we can get our partners to surround them and support them with help as well. So we can pull that information again from our partner meetings, that high-risk team meeting that I talked about. We oftentimes are seeing gaps there of low bonds that are set or an issue where we don't have a service that we really need for a client. We're also looking at those in our homicide prevention fatality reviews. So we're reviewing every fatality that happens that's domestic violence in nature in Nashville and seeing what are some of the gaps that we need to cover from those homicides to make sure they don't happen again. We also have a leadership committee with our nonprofit partners that work on sexual assault, child abuse, vulnerable adult abuse, domestic violence, and human trafficking. And then, of course, we're in court observing just by being a part of the court system and looking at how that process is working.
All right, so now we're at the systems issues, okay? So we've been collecting this information every day. And so our job is then to compile it around what do we do? We have a lot of complaints, we have a lot of concerns, people saying that someone's going to die because of this issue. So we start collecting that. And so we have this chart that is showing you where we are seeing the hot spots that are causing problems. And in those high publicity cases that we started talking about, those horrific homicides, these issues were in some of those as well. Okay, so we have glaring gaps in our court system. And I'm just not sure everyone really sees them as glaring gaps, okay? Like, we talk to survivors every day. We see it. We travel across the country. Becky and I speak across the country, and we know what the best practices are. So not long ago, we had a strong professional metro partner give we had a city from another state come in to see how we do things. They wanted to see our family justice center. They wanted to see the court-based one. They wanted to hear how we do our high-risk work. And they're like, wow, 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 you guys are so great. We want to talk to your DA. So they talked to the DA, they talked to police, they talked to our nonprofit partners. And then one of those folks presented, and it was so back to how things were done in the 90s, like it was progressive, and it just wasn't. And so we need our partners to be doing those up-to-date things. Having specialized judges, having specialized prosecutors is not enough anymore, okay? It needs to be a lot more, and we are definitely behind the curve on that. So we're gonna take them one by one. All right, first we're going to start with uninformed bond determinations. So you've seen a couple of articles, they're in your packet on the left side. And one of my favorite quotes on this is from Judge Jim Todd. And he said, the reality is we cannot set bonds with a Ouija board. And I'm going to tell you why he said that. And this has been how it always has been. So let's go back to the timeline. To show you where the bond decisions are made by who and by who. So when a warrant's taken out, that offender is taken to night court, and that commissioner sets a bond. Commissioners are not judges. They are defense attorneys. Most often, they still do practice their criminal practice, and they're also commissioners, which work 24/7. They work very hard, and they set the bonds on all of these cases. This is what they can and cannot see when they set those bonds. And I bet everyone in here, when the council room's full, they would have assumed that before a commissioner sets a bond, they know what the person's full criminal record is. I mean, how can you set a bond without knowing that? Well, it happens every day. They can see past criminal records from our city if they have the time to look at them. And they can see pending charges in our city. So if they're already out on bond on a case, if they have the time to look at that. They cannot see anything out of county. They cannot see anything out of state. And they cannot see the lethality assessment. So they're really setting a bond with blinders on. And we're in violation of Tennessee law. So TCA 39-11-142, let me say we're out of step with the law. That statute states that we must do due diligence in determining the existence of prior arrests or convictions. And due diligence for our city should definitely be having NCIC III access and access to the Tennessee Criminal History Database. So, I mean, it might make sense that a more rural county may not have all those levels of access, but our police department does, our DAs do, and our commissioners need to have that type of access. And so Judge Todd's been working really hard on how you go about doing that. And I'll talk you through some of that solution in a bit. The other Tennessee statute we are out of step with talks about bond criteria and bond conditions. So this legislative year, there's been a lot more emphasis put on victim and community safety in domestic violence cases. So instead of setting bond just to ensure the offender will come back to court, so I'm going to set a bond because all I have to look at is if you're going to come back to court, it's been emphasized that we have to look at victim safety and community safety in domestic violence cases. Our courts aren't prepared to do this right now. They don't know the results of the lethality assessment. They don't necessarily understand what all those red flags are. They may not have been trained on that. They wouldn't know that even if they do have access to the lethality assessment, if the police officer comes and says, well, she didn't want to do the lethality assessment, that doesn't mean she's not at risk. It might mean she's really at exceedingly high risk because she doesn't even want to sit down and do that. With the bond conditions, we don't have a way to make sure that the defendant has all those bond conditions, that they've been given notice of those, which is required, that those conditions make it into the law enforcement database, because police can arrest an offender on a violation of a bond condition. So if that bond condition is telling me to stay away from Becky, and I don't, police can arrest me right away for that if Becky's been told of that bond condition and that bond condition is put in the law enforcement database. If it's not, they can't do anything. They don't even know about that I'm violating that law, that bond condition. So the average person thinks that a person gets out on bond, has a stay away order. If he comes around them again, police will arrest on the spot. An average person would also think that, let's say a victim's been strangled, that it would be better to set a high bond because the risk to victim, and that's not the case either. Bonds are all over the place. So this is an example of what happens when you are out on bond and you commit another offense. We see that all the time. So again, these are recurring crimes. They happen over and over. I get out of jail. I'm mad at Becky for even calling the police in the beginning. So I'm going to go do something again. So I'm out on bond and I'm committing another offense that I will maybe get arrested for and be put out on bond again. So TCA 4011-148 says that setting a bond for an offense committed while already out on bond should be at least double the amount that is normally to be set. We don't have a normal in Nashville at all. So this is an example. Becky, you understand this example a little better than I do. Can you give an example when that's happened?
Yeah, so this is an example of someone that reoffended while on bond. So this person was arrested on 5 charges that had happened over a course of several months, 4 assaults on the same victim. One of the additional assault was actually on the victim's friend. So one of those assaults included a strangulation. The bond was reduced in those charges from $40,000 to $8,000, and the defendant made bond. After making bond, he then shot at the victim and her 1-year-old son and was rearrested for that. He had said in that one of those original cases that he had 50 rounds and he was willing to use them. So these offenders are sometimes basically prescribing to us, this is what we're going to do, and we're not listening to it. We're not listening to it and the risk and the amount of bond that's being set and when it's reduced.
So when you're talking about the fact that you're supposed to double the bond of what is normally set for that type of charge, and I said we're all over the place, this chart shows that. Assault, there's a $30,000 spread. Aggravated assault, there's a $134,000 spread. Aggravated assault strangulation, $79,000 spread. Aggravated kidnapping, $145,000 spread. Rape, $245,000 spread between what the commissioner set them at, and aggravated child abuse, $50,000. So what do we need to do for all of those things about bond and bond conditions and resetting other bonds? Because high-risk domestic violence offenders can appear as first-time offenders to us here in Nashville, we need NCIC III access. And again, Judge Todd's done a lot of research on this, and to be able to have that access, our commissioners would need judicial assistance. They won't be allowed, I don't understand all the rules, they won't be allowed to look at it themselves, but a judicial assistant for them can. And we also have a lot of other uses for those judicial assistants. Back in, I think, the 90s, commissioners did have assistants sitting with them. They had clerks with them to help look at those records, make sure things got processed right. And those went away in budget cuts, and they've never been put back there despite our growing city. So those assistants can also help us with making sure those defendants get those bond conditions, that those bonded conditions get into the law enforcement database, and also with all the new regulations to make sure the GPS is done correctly. Those assistants, those judicial assistants, we would need one for every commissioner shift, and they're open 24/7. All right, GPS monitoring is the next area.
So luckily, we do have some recent legislation that helps us in this space, the Maria and Debbie Act that looked at GPS monitoring. That new law that just went into effect a couple of months ago says that the commissioners may order GPS monitoring for defendants who've been accused of misdemeanor DV and shall for felony domestic assault charges. So that shall is really powerful. It gives a lot of, really, it takes away a lot of that discretion and makes sure that we're holding these offenders accountable. GPS monitoring, there's still, formative work being done with this with the courts. We were just recently allowed to come to a stakeholder meeting, so that's some positive progress there because we do have several victim safety concerns. And that is that the law includes that the victims have to set the zones with the magistrates. So they have to go downtown, talk to a commissioner about where their zones should be. So imagine you've just been assaulted, it's the middle of the night, your kids are crying, they want to go back to sleep. And then you're being told, I'm sorry, you've got to come downtown and tell this commissioner about different zones that this perpetrator can't be at. There's also issues with potential confidentiality, making sure that these companies, these GPS companies aren't disclosing locations. So locations like the YWCA shelter, locations like the new location that person has moved to, maybe their sister's house to get away. And then we also have the problem of seeing that payment not being supported for these individuals who are indigent or say that they cannot pay for their GPS monitor. And I would encourage you, we don't have this article in our printouts, but there's a recent article by the Nashville Banner called What One Survivor's Story Tells Us About GPS Monitoring and Domestic Violence. And listening to Gina Asani's story is incredibly powerful and seeing all the gaps in GPS monitoring, especially that she is paying for the GPS monitoring of her perpetrator. So lots of victim concerns there.
All right, we're going to take delays, which is a really big thing we want to address quickly. So GPS monitoring, we're going to all sort of see where that goes, and hopefully the victim's voice will be considered in some of the rules and systems that are put around that. Order of protection, bonds, big issue that's got to be addressed. It's certainly direct impact on safety as well as our compliance with TCA statutes. So delays is the next big topic. How slow our courts are working is, again, to the offender's advantage because time kills these cases. And it is telling all the victims that the judicial system cannot keep her safe. And so why should she participate? What's in it for her at that point? She's already had to learn to be safe. All right. So in terms of speedy trial, TCA 4035-116 speaks to the victim's rights to us about a speedy trial. And we're going to go back to this timeline of what happens in General Sessions Court. So again, from making bond from arrest to disposition is 93 days in General Sessions Court. Here are the numbers. The differences between 2013 and 2023. You would think we'd be going in a better direction, but it's gotten a lot worse. We thought it was really bad in 2013. We wrote that in the report as, oh my gosh, this is taking way too long, and then we're nearly doubling it. So arrest to bound over is now at 112 days. That is just a preliminary hearing to get it to criminal court. And you remember, to disposition, criminal court was 380 days. So we're, well in the 400s, 500s. Yes.
What do you attribute to?
Your mic's on, by the way. You can use your mic.
Pardon me. I was just wondering why such a big increase over the 10 years? Is that a function of we're a bigger city now, making more arrests, and we haven't kept up with the number of courts?
I would say there are probably a lot of different things. Yes, we have, a bigger population, certainly. You really have to have a strong handhold on what happens in the courtroom in granting those continuances. You have to be able to deny continuances. Your Your prosecutors, have to be, have to know how to kind of wrap up the case and make it happen. You have to have the judges be able to say, and they do, I'm not saying they don't, but day in, day out, every single judge needs to be able to know when a case is being continued for really no good reason. There's some other factors, as orders of protections are on those dockets. What else would you say?
So I'd say initially, over the last couple of years, we pointed to COVID. That caused a huge backlog in the courts, but we have seen these numbers really kind of plateau out at this current rate. So we're not going back where we should be, since COVID incredibly increased the delays in courts. We're still just kind of hovering at these 2023 levels right now.
And it's definitely frustrating everyone in the system. I mean, it's not just victims that are being frustrated. The judges are very frustrated by this. Prosecutors are very frustrated by this. I'm sure defense attorneys, in some respect, in terms of the public defender's caseload, get frustrated by this. So it's not just the general sessions court. We also have the trial court delays. Okay. So remember, we had the delays down there in the bottom. This is what those numbers look like for the trial courts. So again, from the filing in criminal court to disposition, and for the people that remain in jail is 244 days. And for those defendants that are out on bond, it's up to the 361. So the impact, again, you have an offender that gets to remain in control of their victim during that time. That offender most often is escalating at a rate faster than the system can keep up. That's a big term in our field. Like, the system cannot respond at a rate faster than the defense escalating because our system is so sluggish. Gives defense attorneys more opportunity to stall for better outcomes, more opportunity for the offender to intimidate, threaten, and manipulate the victim, more hardship for the victims with multiple court dates, frustration, hopelessness, and the expenses involved. And the system is validating the offender's words that nothing's going to happen. That's the one that really breaks my heart the most in this. The offenders are telling these victims nothing's going to happen, and we're proving them right every day. So what we want to do is we want to follow and replicate what we're seeing as some national best practices and having high-risk cases get fast-tracked through your system. And we know which cases are high risk because of the lethality assessment. So, back in the 90s, we didn't have those risk assessment tools, right? But we still made a big change. The DV dockets were created in the 1990s, kind of on the back of the O.J. Simpson case. Judge Gail Robinson was ahead of his time in making the decision to do that. Now we know the highest risk case, so we don't need to keep doing things exactly like we did in the 90s. We have more information than we ever had before, so let's use it. So what we need to do is cull out those highest risk cases and track them more closely. If they're out on bond, they need to be coming back. We need to be watching to see if they're keeping up, if they're following those bond conditions, if they're remaining in compliance, if they've dispossessed of their firearm, and then get those cases through our general sessions in our trial courts more quickly. Same with it goes to criminal court. Okay, so fast track a high-risk domestic violence docket in general sessions, and then definitely have one up in criminal court. So stop docketing these cases as if they're the same. When on every trial day in criminal court, they have about 4 cases set for trial that day. And so then lots of negotiation goes on. Some fall off, some get continued, some plead out on that day. And let's say the judge is left with 2. Then they'll pick which case has the highest priority in terms of the level of offense and how long it's been floundering before it's been heard. So domestic violence cases aren't going to make it past a homicide case, right? So they tend to get bumped down. And if it's a simple assault or a low-level aggravated assault that got bound over from general sessions, it's going to be in the lower priority rung as well in criminal court. All right, I just made this before I came, so let's see if I can remember what I was doing. Becky hasn't seen this slide yet. So, okay, so we're taking general sessions court at the top rung, okay? That's the number of cases. The yellow are felonies and the reds are misdemeanor. Those are tons of cases in all of those buckets, okay? So what happens is those cases end up getting filtered out before they go on to criminal court because they plead, they get dismissed, they get retired, they get nollied, and all of those things. And so you end up with less felonies and less misdemeanors, okay? The problem with what is going on is when you have people knowing that a case is going to flounder for those 380 days, as I said, they're going to get those cases bound over and put up in criminal court. And so now you have more buckets of felonies going to criminal court and more buckets of misdemeanors going to criminal court. And so then you're jamming up your criminal court system. So you have to stop up that end of the pipe. There has to be faster accountability in domestic violence cases so people stop shooting them up there as a stall tactic. And domestic violence, 48% of our violent crime in our city is domestic violence. So it's a massive caseload coming through. So this trial court thing is much more than the cases that you see now. It's something that the pipeline just has to stop. So let's look at capacity. And I'm speaking from my perspective, okay? And the perspective of judges that have called me proactively and talked to me about their concerns of many of the issues we're talking about. So this courthouse does have capacity to hear criminal court cases in high-risk domestic violence trials. There is capacity with the circuit court judges in this courthouse, okay? There is not capacity in the Birch Building in the criminal cases, okay? There is an upcoming weighted case study that's going to take place. I think the judges are getting trained on it this week. It's like doing a time study of your work, but for judges, it's a weighted case study. And trial courts across the state are having to participate in this probably in the next month or two. And so each type of case that comes through their court gets a weight, and then it adds up to show how busy or how busy they are not. The state then takes that information to see how many courts our city still needs. If our circuit courts do not do well in that, I mean, some are very, very busy. I'm not saying it generally. It does not do well in that weighted case study, we could lose courtrooms in the city, which would be horrible considering the fact of the backlog we have over there in the Birch Building. So when I said circuit courts, there are 8 circuit courts. 2 do divorce and custody. They are overloaded. There's probate that's overloaded. And the presiding judge, Binkley's court, is always overloaded. They're at full capacity, but that leaves us with 4 more with potential opportunity for reassignment. And I do know we do have at least 1 judge over in circuit court, possibly 2, that would be very interested in hearing these types of cases. So it's something to explore quickly before that weighted case study begins. All right, on to order of protection court delays. Okay, so we want a rocket docket, cases to go faster in general sessions and definitely in trial court. Maybe send some cases over to this building so we can do them more rapidly. But orders of protection are a problem as well. So on this, you can see it takes some time. I think I lost the number of days.
93.
For those other cases?
When they get set with the criminal case.
Okay, yeah, that's right. So right now, orders of protection, if there's an adjacent criminal case, so I've abused Becky and Becky wants to get an order of protection out on me and a warrant gets taken out on me. Those cases will become locked together when they end up in general sessions, criminal and civil court, which they should not be. They should not be stapled together in that way. And when they get assigned, even if they get assigned, so I'm sorry, this is confusing to explain, so bear with me. So this courthouse gets all the order protections for people that have been married and or are married, been married, and or have children in common together. So they get all the orders of protection over here. The vast majority go over to the Birch Building, and it's a civil case. It's not a criminal case. And that's never married, no children in common, right? And since the vast majority are over there, they're on a civil docket that happens adjacent to the domestic violence criminal docket. So there's an order of protection docket and a criminal docket in domestic violence on the same day. And if that criminal case gets continued, which we've already discussed, they're going to get continued a lot, that order of protection is going to flow with it. Yep. You see the problem. So we are daily in violation of TCA statute 363605, which the ex parte order protection, the order protection that we help them get at our center before there's an actual hearing to grant the 1 year, the hearing has to happen within 15 days. There's a must there. It's not a should or would be great if, it's a must. And we are not doing that at all. As you saw, we're at 90. So here we are. The granted order of protections, 25% are taking over 90 days. Right there. Did I say that one wrong?
So this is actually a study that our office did and just looking at attrition. So when those get continued with the criminal case, we see that there's a decrease in the orders of protection that are granted. When they're continued over that 90 days, there's increases in dismisses for failure to appear. So that attrition has that impact that Diane was talking about. It causes victims to fall off from being a part of that case.
See, she was sneaky and she put in a really good slide I wasn't ready for. That's a great information. All right. There is an update on this where just recently last week, we were told that all orders of protection, which are normally heard before the criminal docket starting January 1st, 2025, those will all be heard in a courtroom of their own. Does that mean they're still going to stay attached to the criminal case? I don't know. We haven't been told, but they are all going to go to Judge Kimbrough Hayes. Our recommendation is that they all go to circuit court. This has been something our office has tried to work on with different judges that are in agreement for many years. So that will ensure that they don't have to run with the criminal case. It ensures that they'll get resolved within the 15-day window. It'll also reduce confusion between courthouses with victims showing up to the wrong courthouse and getting their cases dismissed or their order of protection. All right. The other issue is over-reliance on the victim supporting prosecution. Was that one?
No, I can do it.
Sure, go ahead. I've talked long enough.
So one of the other things that we've seen from the time of the assessment from 2013 to 2023 is we're also moving in the wrong direction with our numbers with the conviction rate that we're seeing in our courts. So this is just for our domestic violence related prosecutions that we're seeing from what you can see here, a 18% decrease in guilties for domestic violence. And that's in criminal court, a 10% guilty decrease in general sessions court. So we're not seeing these offenders held accountable in the same way that we did at the time of the assessment. And at the time of the assessment, there was a lot of concern. So again, we're sliding backwards. We're going in the wrong direction. We also are seeing this in our other types of interpersonal abuse. So it's important to note, domestic violence and all of these forms of abuse are all intersecting. We see, for example, a decrease in the sexual assault convictions, in child abuse convictions, and our largest decrease in convictions is with strangulation. So we just kind of briefly sprinkled over how deadly strangulation can be. So it's very concerning to see that there's a 26% decrease in conviction within the courts around strangulation. So one of the things that we look at is specialization. We're talking about specialized court, and that's important to see that in our judges, with probation officers, as well as with our prosecution. So there is a DV prosecution unit at the DA's office, which, as Diane mentioned, back when I was a victim witness coordinator, we did not have. So it is a wonderful change and great progress. We also have specialized units for child abuse, sexual assault, and human trafficking, and vulnerable adult abuse. So one of the things that can be concerning is oftentimes new ADAs or assistant district attorneys are starting their prosecution experience in some of these specialized spaces. So it's really important that we standardize training that's in-depth around these issues so that when they're in the courtroom, getting that kind of pushback from defense attorneys, they have these tools to fall back on. And how do we prosecute a case when the victim is saying they don't want to do it? They don't want to move forward, or they're terrified of that individual. But we know we have a responsibility as the state to provide that safety for the entire county, right? So one of the things that happens when we don't do that, when we say, you don't want to prosecute, okay, will walk away is it essentially places the whole burden of prosecution on that victim. I've worked with victims and survivors of crime for, as I mentioned, over 20 years, and it is an enormous burden to say, you make the choice, you decide whether we move forward, because ultimately it puts a target on that person's back. So we need to be looking at the entire situation and also that lethality to say, this may be something you're scared of moving forward with prosecution, but because this case is so serious and we have these lethality concerns, we need to move forward and hold this offender accountable. So evidence-based prosecution means that we're using some of, especially these new tools that we have. We live in a digital age. We have a lot more information at our fingertips, including body-worn cameras. We have a lot of footage of incidents, of excited utterances when someone comes on the scene and says, this is what happened to me. So implementing those using expert witness testimony is very important. And we certainly have seen this when we talk to patrol in our roll calls, that asking for them to get all of the evidence possible to make sure that we can hold this offender accountable and make this really an undismissible case. Make it as airtight as we can so that once we get in that courtroom, all of those factors that can push and pull whether we move forward are much harder to listen to.
I'm going to pipe in here. We've done a lot of those roll calls and a lot of police trainings. I strongly encourage council members to go to their precincts and ask them how they feel about what's happening with domestic violence cases. That they're the ones who, they're the ones that, arrest. They know that they go back and forth from these cases. They're the ones that did the lethality assessment. Because they're inundating us with information and we're trying to cull it down to get, a talkable message about this. But it would be so much more important for you all to hear their concerns because they are getting frustrated and they are getting disillusioned. And that's why we're sending the message, just, don't lose heart. Make it really hard for these cases to end up, she's going to hand me something, for these cases to end up getting dismissed. And, we just encourage y'all to do that and encourage your peers to do that, please.
Right, and then the last piece of the recommendations you find in the court issues is firearms dispossession. This is something that I have worked on for the last 8 years at the office, not alone, of course, but that has been one of my main focuses and one of the hardest things that we work on in our office because there are so many barriers. So we brought together a team of partners looking at how we actually follow state and federal law. And you can see that in the timeline. I won't go through all of the work that we've done, but please, if you have a chance to look over that, note how much we have put into trying to get our county to follow state and federal law to legally dispossess these individuals of their illegal firearms. So we're really out of compliance with both of those laws. As I mentioned, it's DV misdemeanors, felons, and individuals who have a full order of protection against them. And we're supposed to be making sure that dispossession is happening within 48 hours. So to do that, we need to have compliance hearings. Just like we need compliance with GPS monitoring, we need to bring people back in because otherwise it's the honor system, right? We're saying, okay, we trust you. And even though you did all these terrible things to this person, we think that you've gone ahead and done what you were supposed to do. So we need to have these compliance hearings and make sure that they're held accountable. Yes.
I'll just speak very loud. Okay. So I'm betraying my ignorance. Files in this. How are we going to get for compliance? Like, is that going to also be
So circuit court over in this building is already doing it for their orders of protection. And they're doing it with a special magistrate that hears those orders of protection and does those compliance hearings. And it's been really impressive. There is an ability to do that, especially if we do something with the other end of the pipe up here in trial court, get more cases handled down there, and get all the orders of protection over there. There would be capacity. The orders of protection don't take up it's a fraction of the orders of protection that are heard over here. So there would be an ability to do that.
A great question. And something I think if we're looking at that rocket docket that's funneling in those high-risk cases, that would also funnel with this firearms compliance. We would see those cases. But also we're seeing fewer convictions. And so there are fewer people that are actually needing to be in compliance. So there's a lot of kind of push and pull factors there as well.
I mean, when we talk about these ideas, just go ahead and answer. Can't you feel like if you were the defendant and all these things we're talking about, you're going to be like, oh my gosh, they're really watching me. Someone's going to actually respond and do something to me if I reoffend. I need to do what I'm told to do. That is what you need to do with people that abuse other people and assert power and control. And they think they're in control of everything. They're in control of their victim, and they're feeling, I'm sure, like they're in control of our whole system, and that needs to stop. It would be two things. It would be one, yes, the continuances are making the case lag. So if you had a very dedicated victim to conviction, yes, you might lose that victim along the way. But again, what Becky talked through is that evidence-based prosecution. When I was prosecutor, we didn't have body-worn cameras to use in a case, and we were still able to prosecute cases, not all, but with the other evidence, the 911 tape, the EMS, EMT reports, jail calls. Those are great because, he's got a lot to say to that victim on that jail call. So lots of ways that you can try to gather the evidence to work. It won't work in every case, but if you focus on those highest risk cases to try every possible evidence-based prosecution attempt, you see what you have, and you go for it. That would not be the case anymore, so long as you stop the flow of people just going to criminal court for delay, okay? Because if you're going to do that evidence-based prosecution in general sessions, and you're going to have a likelihood of success, those folks are going to want to go to a jury trial if they're going to end up getting it passed for 380 days. So one thing affects the other, so you've got to take care of both at the same time. And then we just want to tell you about Inner Shoes next week. It's a really great exercise. We've made it especially for you all. It'll walk you through a victim's experience as well as walk you through these exact problems we're talking about to help them make more sense. It's complicated. It's a lot to absorb.
Yeah, I've got several questions, if you don't mind. And you don't have to turn around and look at me while you're delivering the answer. It's probably a little awkward next strain. But kind of going back to the weighted case study, what's the timing of that? I know you said it was just getting started, and like, who is conducting that? How long does it last? When could the state come back and say, like, you got to reduce the number of judges you have?
I'm not sure about all those answers. What I was told is they're being trained this week at their judicial conferences. It's being, the state is the one mandating it. So it's across whatever entity they're having do it is selected by the state. And I feel like I heard that the last time they did it, it's an every 10-year thing that they do. 10 years ago, I think it was, you do the study takes a couple months where they watch and calculate all those things, and then you get the results. Late Judge Smith, this is something he was always concerned and talking to me about, is trying to get some of the cases to go over to circuit court in this courthouse so they don't lose courtrooms.
Yeah, that makes sense. And thank you for that. And when you were talking about the high risk cases, how many potentially are eligible to be reassigned? Like and I don't think I understand how many are designated as high risk.
So that would be something that we would have to work with together with our partners, because there are a number of different ways that we could designate high risk. We could look specifically at our felony high risk cases that involve a firearm and strangulation. That's something other jurisdictions have done across the country, is narrow what the risk factors are. If we looked at every case that's screened in as high risk on the LAP, that would be about 40% of the cases. So it would be a significant number. So we'd have to look at the capacity of the courtroom and see what the judges, DAs, public defenders thought was reasonable for that high risk.
And we're used to narrowing it down like that. Our high-risk intervention panel doesn't review every single case that's been designated high risk. It reviews the highest of high-risk cases, the ones that have 9 out of 11 yeses, or the police officer has written that their concerns that make us concerned as well.
Okay, thank you for explaining that. And I guess you triggered a couple of questions kind of for me related to kind of the bond conversation and like the slide that you had that showed the $40,000 where it went down to $8,000 and that the person bonded out, and kind of thinking about that in relation to kind of bond conditions overall. How would the judicial assistance that you were describing, what would that influence potentially look like related to setting the bond? So that's kind of one part of the question. And the other part is, I watched that one hearing that was done, that was live streamed on, I don't remember which news station, but it was live streamed. It was right after the Lauren Johansson case. And one thing they were talking about, they had one of the bond companies that they were interviewing and talking about it kind of sounded like bond companies are competitive in their pricing and like they would do bond or, submit that for really low percentages. So I'm kind of like thinking of the 40,000 down to 8, but then and the reality is like, how much was their bond? Could it have been like $500 or $250, those kinds of things. But it all kind of ties in, I think, to your discussion about the judicial commissioners and how they would potentially be using that database to be able to provide that additional data that would kind of elevate that conversation.
So those are 3 really good questions circling around the same thing. So judicial commissioners, again, judicial commissioners would sit beside, let's say Becky's the commissioner, I'm judicial assistant. When Becky is processing the warrant and all of that, I'm going to be looking and seeing, okay, what's her record on what's this person's record on NCIC? What's the Tennessee record? I'm going to make sure she knows that before she sets the bond. And then also we have a requirement of her having some bond conditions on this person. So she's going to be looking through what are the options of bond conditions. Maybe she picks 3 bond conditions. And then as a judicial assistant, it could also be my job to make sure that the defendant is informed that those are their bond conditions. Maybe they sign off on it. So he doesn't say, well, I didn't know there were any conditions. And then to make sure it's in the law enforcement system. So when patrol shows up and a condition has been violated, that person can be arrested on the spot for it. So that's for that. For Lauren Johansson, which is obviously just the most traumatic case, that case actually was what normally our system has a little trouble with. That went actually pretty well at the general sessions level. They did an evidence-based prosecution for the preliminary hearing. There was a strong bond that kept a dangerous offender in jail for a period of time, right? So that went as you would want a system to work. What the problem was up in criminal court. And unfortunately, there are lots of fingers being pointed in the direction which I would more focus on. Why were we even having a bond hearing in 7 months? Like, why wasn't he already tried and found guilty? There would not have been an opportunity to reduce that bond, and none of this would have happened. To me, that's the biggest point in this. When the system works right, everything worked right with the system being right, but he was in jail for too long and a judge decided to reduce the bond. And that should, if he was convicted, it wouldn't happen. Becky was actually at the GPS monitoring company hearing. So you want to speak to that?
Yeah, I think it was, to be honest, I worked in the system several years ago and I've been here again almost 9 years. And it was surprising to hear all of the things that we heard in that hearing from how bonding companies work. how little they will actually take of the bond amount that they need because there's so much competition.
Can you
And
explain what you mean by that?
yeah. So, with a bond that's set, so say if you have a $20,000 bond, there's, a 10% payment requirement, that there's $2,000 of that would be provided to the bonding company. And they were talking about how they would take as little as $1 to insure a bond because of the stiff competition between bonding companies. And that was truly shocking. So it felt like bond amounts don't even matter from that hearing, which again just puts into question, if we have these bonding companies and GPS monitoring companies that don't have an innate responsibility for victim safety. They're really looking at the offender, about the money that they're going to get, making sure that they'll get that money. So maybe they'll put a GPS monitor on that person just even for their bonding company, but they're looking out for those funds that they'll get, and not necessarily looking at, for example, Lauren Johansson's safety. And for example, that GPS monitoring company had mentioned that they got their exclusion zones, so where that perpetrator couldn't be, from the perpetrator themselves. So they asked him, where should you not be? And that, again, it just shows there are so many gaps that we've gone over. There are even more gaps when we look at cases like that. And as Diane said, we had a high bond in that case. And that isn't necessarily the case with all of these high-risk cases we're talking about. And I think it's especially because you could visibly see how significant that abuse is. And you can't always see that visible abuse with a firearm charge. With a strangulation, only see 50% of the time injuries with that strangulation. But that was a very visible case that got a lot of high bond set, evidence-based prosecution, a lot of attention to it. But we don't see that with all our high-risk cases.
I'm just going to dovetail on that. Your committee really understanding the ins and outs of the criminal justice system is truly so important. And domestic violence is a great place to start to understand it. So I really appreciate you all taking the time to do that, and whoever else you can get to understand the system, so we can actually have some oversight over what works best and what doesn't, and have good efforts to make improvements together. It's really important.
Thank you for sharing the information on that, and kind of, I guess, related to like our existing structure. Of course, we're like October and it's the middle of budget, we're like in that gap period between, like, people are talking about the future budget, but really it's like we locked the budget in. And so how do we kind of improve things or speed up the processes, with existing resources? Like, because I understand Judge Todd, and his advocacy for these commissioners, and of course the state law piece, which did the state decide, like, you got to be in compliance by X day? Like, have they made, like, is there a line in the sand where they're like, hey, you got to make sure you're all ready to comply? And so how do we manage it with state resource, or continue, or existing resources, knowing we have a state law that we need to abide by?
I would assume that the judges who are working together on the GPS monitoring, and Becky and I have been put in the loop more recently, they're going to come back with a number of what they think they need. I'm sure the judicial assistants, there's a number behind that. These other things that are softer about changing actual processes of how we do existing things, such as, moving some of the criminal domestic violence cases over here to stop up that pipeline, that just takes a leadership conversation and I think that health and public safety is a great venue for those conversations, and those critical conversations from knowledgeable people like you all, asking those knowledgeable questions to get the actual answers and see what we can do, and say, well, we think we're going to have some extra time here, so which judge is going to pony up and start hearing these domestic violence trials?
So our meeting on the 30th will be a good place for us to ask some of those questions.
Question, David.
Yes, I'm sorry for monopolizing. You know me, I got a million questions. Councilmember Benton, you're probably going to capture some of the things I'm thinking too. Look, you're all ready to go.
Hey, I'm good. I was making notes, and the reason I broke into a grin a few times is because they got answered along the way. One of mine was, do you have federal grant money available for your training that you do for other people? Because apparently you're investing quite a bit to help others.
Right. We do not right now, but we have the capacity to train anyone that wants to be trained. So, and we have all the national best practice training materials. So
Good.
when everyone across the state and country asks us to train, and your local people are like, no, we don't think so. It's a little frustrating.
Well, I think you deserve to have some. Another one I had was a higher bond for higher risk offenders based on your risk assessment, but I got that answered in number 4 of my questions. Yeah, that was part of that. Right to a speedy trial, obviously, is important to all of us as constitutional followers, but that's important not only for the accused, but for the victim, in this case, obviously. And so everybody wins there. Number 4 I had was, can we set up with data? That's the data-driven information. I know you're getting access to more data now. An analysis that be calculated, weighted by factors such as known pending cases, past cases that you mentioned, and then, of course, the NCIC database, pulling that in as a nexus with this other data. And then, we're using the weight and the calculation, plus your lethality analysis, and come up with, say, a number, low, medium, high risk, and it flags directly through our assistants, to that night court commissioner. So they can then look at that and go, oh, I got to set some high bail. I mean, that would help. Just, it's black and white, right? Maybe it's red for the high or extremely high. How do we get that data in one nice package for you as, say, an assistant to print out and then hand that commissioner, and they go, wow, we need a GPS and bond right here, right now.
So, I like the idea.
And
you're
an order
talking about.
protection.
I like the idea you're talking about with it. It's kind of like having zones. Like, which zone are you landing on, given these factors? So, if I were sitting there as a process person, I would have, my digital checklist of like, okay, yes, there's NCIC history of domestic violence. There's local history of domestic violence. Maybe they were dismissed, maybe, but which are the convictions? How many orders of protections against this person have been granted? Were there past strangulations? Were there past firearms? And we do that for every single person that comes to the domestic violence docket. We determine which ones are stranglers and which ones have a history of possessing a firearm, and we pass that information on to the district attorney's office every day in court. So some of that information is being gleaned. It's not that hard. And so then from what you're saying, they pick the zone. You can't say, oh, this, you have to do this amount, but certainly a risk zone.
And can that be dynamically updated over time so that well, this one's getting on a hotter fuse, and this has to be escalated to a sooner court date, I guess is where I'm going.
Well, once you have that normal zone, especially if they're already out on bond when they're escalating, then you're going to know it has to be doubled from what was normal, because the statute says that, but the problem is we don't have a normal. And who's in charge of the commissioners is there's usually a general sessions judge that is in charge of the commissioners. And there's always a presiding general sessions judge as well. And they work really hard to get things functioning well in this process. Would you have anything else to say on that?
I'll get Councilmember Ewing, and then we'll go to Councilmember Nash.
Thank you.
It sounds like it should be on. Is it on this time?
Yes.
Oh, awesome. Rosie's
Berkeley's
awesome.
setup is more problematic than mine. Okay, so I'm sort of stuck on the bond thing that you were saying, and I'm sitting here wondering, are there any ways to embed more accountability within that part of the world? Like, I don't know. It seems like that should be something that we can tackle and make work better. I guess I'm just throwing that out. I have no idea what that would look like. But that seems crazy.
I think that's a starting point. I mean, correct me if I'm wrong, but is someone in position of power in our metro government is looking at this and saying that this doesn't make sense? I want this explained to me. Is there not a better way? And that's how change starts.
Ooh, I guess I'm thinking back to my time when I worked at the legislature. The bail bondsmen were that influence was very powerful at the state. And so I would assume it's carried on today and it's still very powerful. And so what kind of regulatory body exists at the state level to oversee that? Because I would imagine that some of the issues that you described today are also happening in other large municipalities.
Oh, I don't know of a regulatory body. I know that our bonding companies are overseen by our state trial court judges, and that was why they were holding that hearing to kind of get an understanding and see if there was any wrongdoing that happened. And you might have seen the recent article that came out where they said while there were several places where the ball was dropped, there wasn't a specific and intentional act of wrongdoing. So I think that was a really important hearing. It's the first time I've ever seen a hearing like that in 20 years. So I think that's an important starting point, but asking those questions about how these are regulated, as Diane mentioned, I think is another step to move it forward.
Yeah. Councilmember Nash.
Thank you, Chairman. Every police officer in the Metropolitan Police Department has access to NCIC, and I'm curious why we don't have a computer and a printer down at night court. Guy can go over before he presents to the commissioner and run off the NCIC anyway.
There are a lot of regulations around NCIC checks, and that if they are misused for any reason, or someone that isn't supposed to have access gains access to that information or is told of that information, we can lose NCIC access across the board, across all metro. So it is probably one of the most safeguarded things. I mean, we're not even allowed into a room that has a computer with NCIC access in our building. All the windows between our office and police which was supposed to be like beautiful and we could see like the sunset, like they fogged it up because we might from 30 feet be able to see a computer screen. So it's really serious. So Judge Todd knows all the reasoning behind that because he's the one that's really dug in. And those judicial assistants are the only way they can do it. I don't know how when they're looking at it and then they can tell the judge, but there's some reason for that, and that was the only pathway. Do you know anything else? I mean, that's all I've understood.
Councilman Vogt. Uh-oh.
That's okay. Thank you all so much, Madam Chair. Representative, I was just wondering, like we were saying, identifying all these gaps and
Thank you. I'll scoot over to you. But, just hearing about these cases and the situation, I think about, what are some preventative measures that we can do and what are things that we can do in the community so that we can all be knowledgeable? Because I will tell you, the only things, I would say that I knew about bail bonds was like the advertisements on the benches. And I think it's really critical, like, how the processes all work together, and so that we can be better advocates now, in our seats. So a couple of things, and especially with children. So are there anything in the schools, like, is there anything now, just like if you hear something or see something, how to contact someone to the school for students? I'm just curious about that before we go to court. I mean, or before the 911 call. I feel like there's still a lot we can hopefully do.
In the schools, we have a program that's called Handle with Care. And it's a program that started out of West Virginia where basically they will flag children, the Metro Nashville Police Department will flag for the schools a child who is arriving to school the next day after a critical incident. They won't tell the schools what that incident is. It may be domestic violence related. It could be their parents were arrested for substance use in the home and the child was in the home. So it gives the schools at least a general flag, like this child needs to be handled with care. So that's a great program was really championed out of the Metro Nashville Police Department. But I think there's certainly room to grow our work with Metro Nashville schools around how we talk just, more generally about healthy relationships with kids. We see domestic violence really impacts the ages of 16 to 24 the most. That's the highest rate where we see intimate partner violence. So, and it's continuing to start at younger and younger ages. So I think there is still a lot of collaboration that we would love to do with Metro Nashville schools. Is that?
Yes, we have an outreach team in our office. You all funded that a year or two ago, which has been fantastic because a lot of people didn't even know the Family Safety Center existed. So we're getting that word out. And Courtney, who's sitting in the back, has been working hard to get our messaging in the schools and training the social workers over there. It's just, there's never enough. There's never enough ways that you can get into other parts of your community, other entities, whether it be churches, other places of worship, schools, employers, just it's across the board to try to get everyone to know what to look for, what to watch for, what to do if it happens. Even within Metro, we have a domestic violence policy, which is great because now when there's something about domestic violence in one of the departments, they at least know to start by calling us and know a few steps along the way to be careful of and little pits you can fall in and make things worse for people.
Courtney, could you raise your hand just so we know who? Okay, thank you, Courtney. Councilmember.
Okay, so earlier in your presentation, you talked about other vulnerable populations, like those with disabilities, the aging population, and cases of abuse with those populations. I just wondered, in general, what percentage of cases do you see that involve those vulnerable populations?
It's very small coming into our office. The district attorney does have a vulnerable adult prosecutor that's new, and the police department also has, I think, 2 detectives that specialize in vulnerable adults. And that's an outstanding change for our city in the last year. And that prosecutor and those detectives are really good at what they do.
And we see about 1 in 10 individuals nationally who are impacted by at least elder abuse. And that vulnerability of someone who's disabled, it significantly increases their risk of being abused over their lifetime. Yeah.
Councilmember Nash.
Thank you. Just a couple more issues. We've talked about officers being able to have access to the bond conditions. Is that database available now, or is that something that has to be developed yet?
I think we would need, I'm not certain, I think that's a great question to ask police and the courts when they come in at the end of the month, what would be the process for that? The general information I have is you would just need to funnel the information through possibly the sheriff's office or a law enforcement database, but I don't know what those are. I didn't get the impression it has to be a new database, but it's a matter of inserting that information. That's going to be a process. It's probably working with the sheriff and the chief.
At one time, we used to call the sheriff's department to see if they had the information, but I don't know if those
And I think
lines are still
that's
there.
not going to happen on every case, that they're going to call and see, does this person have a bond condition? If the victim maybe tells them and they can reach someone during the hours of that assault, then yes, they could probably find it out.
And in the discussion of bonds, there's been a lot of discussion about bonds for people that are indigent, can't afford to pay. What kind of pushback do we get from that
So about
advocacy group?
about 9 years ago, I think it was, I don't remember the name of the group, but they have sued different cities to eliminate cash bonds. And Nashville worked with them very carefully under the leadership of Judge Bondelli when he was practicing as a judge here. And we did, figure out what cases was that appropriate for, to have no cash bonds, and what cases is that not appropriate for. And the not appropriate was the violent felonies and domestic violence. Those were carved out.
Thank you.
I did want to add just quickly, I had a nice person send me who the regulatory agency is for the bail bondsmen. So it's the Tennessee Department of Commerce and Insurance. That's how they actually.
Thank you, nice
We
person.
learn new things all the time too.
Vice Mayor, Vice Mayor, did you have any questions you wanted to ask in your capacity? Or maybe not, sorry.
Oh, there we go. I don't, Chair. I appreciate you. You have addressed several of my questions. I've been taking notes, as have our members. And so I would just like to express my appreciation. This is a lot to absorb, but I appreciate the way in which you've presented the information. And I think as I kind of look back at it and think about kind of distilling it for consumption of the broader council beyond this committee or with other members of this committee. I think, kind of first and foremost, kind of where do you hang your, not necessarily policy hat, but, the associated funding from a budgetary standpoint and those commissioner assistants. So I'll be interested to see whether it's Judge Todd or who's kind of coming up with, it's this many people full-time, what is that specifically in the next budget? And then as well, just kind of pulling together, because they were on somewhat disparate slides, but all those places where we are out of compliance with Tennessee law, and kind of distilling all those maybe into one place. Because they were sort of issue associated throughout your presentation, rightly so. But I think if we were to pull all those back together and say, these are the 5 places where we're out of compliance with state law, I think would be helpful.
That's a great idea. The easiest way, if you want to refresh on what we said, is in the folder, in the first thing on the right that has the weights of justice on it, so the scales of justice. So that sums up all the recommendations that we had. And then there's an article on the left side it's a banner article that I think did a really good job summarizing some of these issues as well.
Thank you. And then I guess kind of to the Vice Mayor's point, or just, we've talked about Judge Todd. Obviously, he's an ally for you and what you're doing and his interest in improving things. Who are your other allies that you can name? And because obviously, we like to support people who are making positive changes.
So, I think our office has a ton of allies. We could sit here all night and go through our allies. In terms of who has been reaching out with these concerns, the sentences we seem to hear is, I'm really concerned about this. I don't know what to do. I don't know how to make this change, so I'm coming to you all. And that hasn't happened like that since I was in Carl Dean's office. So I was really surprised to see that. Judge Phil Robinson has a lot of thoughts on how we can improve. Stephanie Williams, I think, does as well. She has a lot of experience from working with Phil Smith, the late Phil Smith. Lynn Ingram has a lot of interest and experience in this area. Judge Steve Dozier. Judge Angie Dalton, she's done, she was a specialized general sessions domestic violence judge before she moved to criminal court. So that's a good, strong cluster right there, as well as, we do have our domestic violence judges. We have Judge Walker, Judge Floyd, and Judge Escobar. And Judge Kimbrough Hayes does some orders of protection. So they, I'm sure, have thoughts on how to improve the system. I do know that Judge Walker is the presiding judge now, and she's been trying to, she's read that white paper that we have that's in your folder. And, she let us know she thought there were some really good thoughts and ideas on how to change. And she's the one, along with Judge Escobar, that's working to at least try to get the orders of protection heard in a faster way. I don't know if it'll make the 15 days, but there's efforts in that direction. have I missed? And I've met with, Glenn Funk, and I walked through, the white paper that you have with the scales of justice with him. We've talked to the chief about it. I mean, all the main stakeholders we have sat down with, and we have talked through our concerns and recommendations, as well as our successes.
So it sounds like there's going to be no problem with them implementing your recommendations based on what I'm hearing.
Absolutely. It should be smooth as silk.
That's right. Does anybody else have any other questions before we wrap up? All right. Well, first of all, before we close, I really appreciate your presentation. To Vice Mayor Henderson's point, I think it was really well presented information. It is a lot of information. I'll probably have to go back and listen to this 2 or 3 times before the 30th to make sure I'm asking all the good questions. But thank you so much for your time and for being here, and for everybody in the back who's here to support and all your work as well. So have a great rest of your evening, and we're adjourned.
We appreciate y'all. Thank you.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.